Well, you've been tied up with the pets, and what are you going to do with them? Well, we've got a great place for you to come and check out, maybe get a playmate for that friend. What do you think, Robert? Robert Blizzard, Executive Director for Norfolk SPCA. Because if you want to get a pet after the holidays, you're a good place to come.
That's right. Well, we're a good place to come to adopt any time of the year, as is any shelter.
Right, because you didn't quite, you thought you were going to get a puppy, but you didn't, so you come on over. But you're bringing a doc and the director of the clinic with you. So what's this got to do with adopting a pet?
Well, we have services that we can offer to pets that are adopted from our shelter, any shelter. But we wanted to bring these folks here today because the Norfolk SPCA, in addition to being a shelter for homeless animals, people often don't realize that, the fact that we have a clinic that is open to the public. People who have known us for many years, they've supported us, they've adopted from us, they don't realize that we also offer the public affordable veterinary services. I'm
going to have to say, I'm along with the viewer. I didn't know that either until you called to set up this interview. So let's go for it. Dr. Kirsten Jagerson. You're the primary vet there?
Yes, so I'm the lead veterinarian. I just took over in July. And so basically we have a full service veterinary clinic. We can do diagnostics, surgery, dental cleanings, pretty much anything that you would need as far as wellness or preventative care.
Okay, I'm going to have to ask you this. Where do you begin? You got a 12-year-old beagle that's got bumps all over her and little skin tabs. And I can come in and tell my doctor, I got this bump and skin tab and it feels this way. Where do you start with a 12-year-old beagle? You can't talk to him, or can you?
Oh, no.
Good.
Yeah, so I would just, listen to what the owner has to say about what's going on with their animal, and then, do a physical exam, be pretty thorough about it, and just kind of have my own opinions and then, offer further diagnostics. So a 12-year-old beagle that, presents with multiple masses of, we don't know what kind of mass it is, so probably want to do some blood work, and I would definitely want to, stick the mass with a little needle and just get some cells back and see, is it just a fatty tumor? Is it something more nefarious that we need to, work up and then maybe, potentially take off? So that's where I would start, make sure they're an anesthetic candidate before going ahead with any type of surgery. But
the reason I mentioned, number one, you're not going to give me personal opinions because I'm going to bring my dog in, but a lot of people would say, she's old anyway, I'll just put her down. And that's really what you're trying to prevent, right?
Right, absolutely.
So Linda Gould, you're the practice.
Yes.
You're kind of the director of that.
Right.
So how do you feel when an old 12-year-old beagle comes in with bumps on him? We don't want to put them down.
Right, absolutely. So we try to give owners other options and still keep the pet in the home.
Okay. One of the things that, we don't have really good insurance.
Right.
So it does become expensive. So what would you recommend, Robert, to that person who may not have the funds?
Well, that's where we come in. That's the kind of place we want to be. We refer to ourselves as an affordable veterinary clinic. We offer all of these different services. Dr. Jagerson mentioned some. We also offer a walk-in vaccine clinic as well, open 6 days a week, no appointments necessary, exams, etc. So we would be just the kind of place to turn to if you love your pet, but you realize you have a very high veterinary bill, maybe got an estimate somewhere else. We might be able to help out in that circumstance.
Okay, but your primary target, you really want to try to reach out to people who might make the wrong decision and give up because they don't have the money. That's really who you'd like to serve primarily, right?
Sure. It's referred to in the sheltering industry as surrender prevention. We want to keep people from giving up on their pets. We want to keep those bonds in place.
Now, I'm waiting for somebody to bring up the topic. It's always one that's kind of awkward for guys to talk about, I think, spay and neuter. You got that? It is, I'm sorry. Especially when you start talking snip, snip. But you got that puppy for Christmas. You're not really sure if it's been spayed or neutered. Bring him in.
Absolutely. I was just looking at our statistics before we came on the air, and just this year alone, we've done almost 4,000 spays and neuters out of our clinic. So just think of the number of unwanted animals who will never go into shelters as a result of this operation. Guys need to get over it.
I'm glad you said that and they didn't. So what kind of cases are you seeing at the clinic?
Oh, just a myriad of things, anywhere from, the 15-year-old poodle that needs dental extractions to the 8-week-old puppy that just needs its first vaccine. So I mean, it's anything in between. I mean, we treat endocrine cases, just, you know, limping, if they've got any type of, you know, just.
How about an overprotective owner? No.
Yeah, no treatment there.
You just have to let them know there's nothing wrong with your pet, right?
That has happened, yes.
So, now the clinic, we're taking advantage of assuming that everybody knows where the clinic is. Where is the clinic?
Sure. We are at 916 Ballantyne Boulevard. That is the intersection with Virginia Beach Boulevard. Just a hop, skip, and a jump from I-264. We're open 6 days a week. All of our information is on our website, norfolkspca.org.
And the building's kind of looks a little different, doesn't it?
Yeah, just about a year ago,
I thought
actually.
it changed.
Yeah. We had a paint job outside, so we have a wonderful design that was donated to us. It was pro bono, done by Clark Nexon, and we are very happy with it. We've gotten a lot of compliments, and so we're not just new on the outside. We've revamped a lot of our programs and policies and procedures, and we're saving more lives than ever at Norfolk SPCA, so we hope people will come down and see us. And the clinic is a great way to get the best for your pet at a low cost.
There you go. Doctor, I've got to ask you, I'm thinking automatically dogs and cats, but what is the most unique animal you've had come in?
Yeah, we have guinea pigs and rabbits, but or hamsters. I did a little surgery on a hamster once.
It would be a little surgery.
It was. He had a little cheek pouch that was coming out of his mouth instead of in his cheek. So, and that was successful. So, yeah, we'll see pocket pets also if, you know, we can. So.
Cool. Well, thank you for coming on to kind of tell us that there is an option other than turning in your animal, but bring them on over and have them looked over.
Anytime.
Okay.
Absolutely.
Thank you.
And Bob, we're going to send you an invoice for the 12-year-old beagle that we consulted.
Yeah, she seems to be perfectly fine to me. Okay, thanks. Thanks a lot. When we come back, it's Move It Monday. Stay tuned.